Okay, it's the new year and most people are now back to work and school.
There are a lot of concerns, though, about a surge in respiratory viruses following holiday gatherings and New Year's celebrations. Here to talk about it is the Regional Director for the U.S. Department of Health and Human Services, Dr. Dara Kass. Dr. Kass, nice to have you here on Good Day. Happy New Year.
Happy New Year.
So what are you seeing right now, and when do you think we'll see like this little uptick?
Well, so I think that we are in the middle of the uptick, and I think that we're going to continue to see, circulating viruses, especially after people had what was a really amazing holiday season, right? We saw a lot of people going out, seeing their family. We hope people tested before they got together. We hope people masked up if they were worried about carrying something, but we know, some people just went into parties and said we'll deal with the consequences afterwards, and for that, some people may find themselves with sniffles or cold, and we want people to know that tests are important, to make sure that you mask up if you're not feeling well, and to make sure, most importantly, that you've gotten your updated vaccine to be as protected as possible going into, January, February, and March.
So my family members, thank goodness, did not have COVID this time around. But my mom had a wicked cough. I mean, literally for over a month. We COVID tested her several times. We got her a flu test. And then finally, in the third week, we got her antibiotics. She finished the antibiotics. She still got the cough. It's like it won't go away.
Right, and eventually it will go away. I think a lot of us are looking for answers when we see a virus. We know we can get an answer. Is it COVID? Is it the flu? Is it something else? And the most important thing to remember is if it's not COVID and it's not the flu and you're treating your symptoms, it will be okay. And to just be vigilant about spreading it to other people.
Talking about COVID, there is a new variant that is out there that's spreading pretty quickly across the country. What are you hearing about that? What are your concerns about that?
So in all fairness, we're really in the same place we were before this, which is to continue to make sure people are vaccinated, to continue to make sure they have tests in their home. You can go to covidtest.gov and make sure that you get your tests at home.
Are the tests still free? You can get, because there's some confusion sometimes where there was the government money was running out. Maybe I can get a test. Are they still? Can you still get a free test?
You can. So last month we reintroduced the opportunity to get tests at home. So you just go and you put in your name and your address, and you can get COVID tests at home. Insurance still covers COVID tests every month, 2 per person in your family. So it is important that you have tests at home and test up if you're not feeling well. But if you don't have COVID and you still aren't feeling well, it's an okay idea to put on a mask just when you're going to be around other people.
Doctor, I wanted to ask you a question. I mean, obviously, we're talking about RSV, we're talking about the flu, we're talking about COVID. You look at the pharmacy sometimes. I have 4 kids.
Yeah.
Tylenol, Motrin. Where is it? What is happening? I mean, are you hearing from any? Where is this stuff?
So we are hearing that. I think, especially infant Tylenol and Motrin,
yeah.
People are concerned if their child does get a fever. We're not hearing as much about people who are having a fever and not able to get it, but more in preparation. One of the things I tell my friends is to make sure you are prepared. So if you have a child that's maybe 6, 7, 8, to ask your pediatrician if you can use anything in your house to treat their fever. Most kids' medications are dosed based on their weight. So find out what you can treat your kids with, and make sure that you're vigilant about knowing what's around you. Go to local pharmacies and see, but the supply is there, and we will see it return to shelves very soon.
I mean, maybe it's just a problem with the pharmacies being robbed. I mean, because there are pharmacies in my area where, like, literally, there's nothing on the shelves.
Nothing at all.
Yeah. There's nothing at all.
Tylenol and Motrin.
And I don't think it's a supply issue. I think that the pharmacy at some point is going to close.
Well, I think a lot of things about making sure that local pharmacies have the medications, but making sure that everywhere you go, you look for that medication and just have 1 bottle in your house.
So can we talk a little bit? I mean, do you remember when we were dying to get the vaccine, right? And we were shamed. God forbid you jumped the line. You were shamed. How dare you want to save your life? And now you can't give it away because people are not going to get the booster.
So people are getting the booster, but certainly not enough, and especially people that are over
I
the
hear
age.
like more than 50% of New Yorkers are not getting the booster.
Right. So I think that we need to remind people that for some reason or another, some people haven't gotten the booster that should. People over the age of 55, people that are immune compromised. It's really important that we stay up to date on the vaccine because it really is the best protection going into any months going forward. And so what I say to people is, I don't know why maybe you didn't get the updated vaccine yet, but we're ready for you. These vaccines vaccines are still free. Vaccines.gov.
I think part of the problem was that people were concerned that they didn't know if it was effective or not. Because what did they test it on 5 mice or something like that?
So again, remember, these are safe and effective vaccines, and every year we update the flu vaccine, and this is the same strategy, which is that we make sure that it is an updated vaccine for the circulating variants and make sure people are protected.
And Doctor, I mean, just sort of wrapping up, I know we don't have a lot of time, but we obviously are seeing some things that are changing out of China, where a lot of countries are sort of starting to test more when people come out of there. What are your concerns right now, I mean, as we move forward into the beginning of the new year? Again,
I think that 3 years into this, my concerns aren't changing as fast as they used to, which is that we know what to do here. We've been doing this for a long time. We know.
What's going on with China? Why are we seeing such an uptick with COVID in China, and now we're testing to make sure that they're, well enough to come into this country?
Well, again, remember that, testing when there are surges is important, but protecting yourself is the most important. Here in New York, it's important that we take advantage of the vaccines, the testing, and the resources we have. And thank God we live in a city where we have those resources available. So that is my message for New Yorkers.
Dr. Dara Kass, Regional Director, U.S. Department of Health and Human Services Region, thank you so much for being on Good Day New York, calming our fears for 2023. All is going to be good.
It's going to be okay.
Happy and healthy.
You too.
All right. Thank you very much.